Record heat waves are sweeping the world, and scientists say this is the new normal. In the U.S., Phoenix is one of the many places in the Northern Hemisphere battling the extreme temperatures. Arizona's state capital has experienced an unprecedented 18 consecutive days of over 43 degrees Celsius. The heat killed over 400 people in the wider county last year, with the city's homeless population among those most at risk.
The streets of Phoenix, Arizona are sweltering, and few are suffering more than the city's homeless. For Christina Hill, this piece of flimsy tarpaulin is all that protects her from temperatures of almost 50 degrees Celsius.
Last year I had a heat stroke staying at the park during the day, and I don't really remember any of it. I still haven't come back, but I woke up in an ice bath at the hospital. So
come over to the tent.
The Salvation Army are doing all they can to help,
shampoo,
providing not just basics, but a reason to carry on.
Survival. If I didn't have them coming, I don't know what I would do. So, yeah, it's hard. Sorry.
Without this charitable assistance, many of the homeless fear what could happen.
I got this water.
Oh, it means a whole lot, like in the world, like, because without water, we'll be, like in the hospital right now for dehydration. And I thank the people for helping out a lot, because without them, we'll be like very sick, and like I can't imagine.
The Salvation Army have been helping almost 500 people a day in the current heat wave, doing the most good for those who need it the most.
Dr. Weiss-Durrani is an emergency medicine physician in Houston, Texas. Welcome to the day, Dr. Durrani. And temperatures are quite brutal where you are. Are emergency units already feeling the heat, or more people being brought in due to heat-related conditions?
Yeah, absolutely. It's definitely been a tough few weeks and a tough summer. It's a common topic of conversation amongst us physicians at each shift change about how many heat-related illnesses we're seeing. We're seeing everything across the spectrum. So, people in their 20s and 30s that may have been outside for an extended period of time showing up with kind of mild symptoms of dehydration where they may be having cramping, they may feel nauseous, really fatigued. But the really kind of concerning thing is we have a lot of folks that have chronic medical conditions who may be elderly who are exposed to these temperatures as well. And that's when you get into those diagnoses of heat exhaustion and heat stroke, where you get the damage to your organs, so kidney damage, muscle breakdown, and as your piece alluded to, heat stroke, where you get confused and your brain essentially stops working the way that it needs to. And that's when those patients come in with extremely high temperatures, and that is life-threatening. And it's something that we've been seeing since, mid-May, and we're continuing to see. And unfortunately, it doesn't look like the temperatures are going to be much cooler over the next few weeks or month at least.
Is there enough awareness among the public, especially the vulnerable demographic, of the dangers of exposure to heat and strong sunlight, of course, as well?
All in all, I'd say no. There are some communities that do a good job of kind of making people aware of the emergency that is this extreme degree of heat. I like to compare it to like a hurricane, right? If Houston is about to be hit by a Category 5 hurricane, everyone knows it's coming. Everyone's making the preparations that they need to. They may be evacuating or storing up on food, water, that kind of thing. There's no urgency to that level when it comes to the heat. Yet people are still dying, and especially those who are vulnerable or at extreme risk. And so I think some cities are doing an okay job of providing resources and making sure people know that these resources exist, but some people and communities aren't. And we need to make sure that all communities across the entire country and globally are activating healthcare resources, activating cooling centers, making sure that those that are at higher risk know of these resources and are being provided with those resources so that we can save lives.
Heat waves seem to last longer and longer. How big of a difference does it make for the body to cope with these extremes for a couple of days or 18 days, like in the case of Phoenix?
It makes a huge difference. If you are exposed to one day of heat and then the temperatures cool down overnight, your body is able to recover. But if, as you mentioned, if it's going on for weeks, it's harder. And especially if you're homeless or you don't have access to air conditioning, all that fatigue and tension that your body is under builds up to the point where a lot of times your body may be able to compensate, and you end up in the hospital. Especially those that have chronic medical conditions. So you may not be homeless, but you have chronic, diabetes, heart failure, lung issues. And, we all can't stay inside for 24/7 for, 3 weeks. You have to go outside to work, complete your daily tasks. That kind of adds up. And, the first few days you may be okay, but a week or 2 weeks in, it finally catches up to you. And especially if you're in that high risk kind of medical comorbidity category, unfortunately, a lot of those folks end up in the hospital.
What is your advice to people facing these protracted heat phases then?
Yeah, unfortunately, the best advice is, stay inside. But as I just mentioned, because these periods are so long, it's hard to tell people to not work. If you have kids, it's hard to tell them, hey, it's summer break, you can't go out to the pool or you can't play outside. So, number one advice obviously is to stay out of the heat as much as possible, but knowing that we have to be exposed to it to some degree, I would say focusing on hydration. Whenever you feel thirsty, it's already too late. You're already mildly dehydrated. So making sure you are forcing yourself to drink healthy fluids to stay ahead. If you have the option, if you're outside and working, of even 5 minutes of shade, that makes a huge difference, especially when the heat index is 115 or 120 in places like Houston. Making sure that we check on our neighbors. That's another big thing. We may be okay, we may be able to compensate, but that elderly neighbor or that neighbor with numerous comorbid conditions may not be. And so making sure that there is some type of system in place to check on those that are at high risk. And then, if you feel exhausted, nauseous, vomiting, confused, any symptoms that are not normal for you, seek medical attention, because the earlier you seek medical attention in a heat-related illness, the higher the chances of recovery.
And meanwhile, large parts of southern Europe are sweltering in record high temperatures. About 20 cities in Italy have been put under red alert. People are being warned that the heat could pose a serious risk to their health. Rome, Florence, and Bologna are among the areas most affected. Residents and tourists have been asked to avoid direct sun during the afternoon. The forecast also suggests Sicily could break Europe's record for the hottest temperatures by reaching 49 degrees Celsius. The island set the record at 48.8 degrees in 2021. And we can speak now to Francesca Reciopi. She is head of the European Center for Environment and Health at the World Health Organization, joining us today from Rome. Thank you so much for taking the time. I'd like to ask first whether countries in Europe, such as Italy, are they adequately prepared for these record temperatures?
Well, European countries have had several years of experience of extreme weather events and extreme heats. Perhaps you may wish to remember that already in 2003, Europe was affected by a major heat wave. It killed at the time an estimated 70,000 people. So since then, over time, a growing number of countries have been getting better prepared and adapting to climate change. Italy is among them. One of the key tools that they have been using has been the development of the so-called heat health action plans. These have been developed by now by more than 20 countries. So 20 countries still too low. We need more of them to be prepared for that, because these plans save lives. And they save lives because they prepare the whole system, from early warning systems, identification of the most vulnerable group, and how to heighten and better prepare to respond. Because our ultimate objective.
Yeah,
yes,
we have authorities then responding to these changes, to these increasingly extreme weather events. Is there anything, though, that can be done at the root level to stop and reverse climate change and what we are seeing in terms of extreme weather?
Well, the extremes that we are seeing now are part of a global pattern. So these heat waves, they have become stronger, more intense, and appearing, for a longer time in more places. This is all part of climate change. And climate change is a global existential threat that requires a global, coherent answer at the political level. This is why we have in place important instruments like the UN Convention on Climate Change and its parties who need to negotiate. And this is also why a couple of weeks ago in Europe, 53 member states were coming together in Budapest, ministries of health and ministries of environment. And one of the key items they were addressing was how to increase our capacity to respond to climate change, including by developing new partnerships and working together towards that objective.
Well, thank you so much for taking the time to speak with us on this really important story. That's Francesca Reciopi, head of the European Centre for Environment and Health of the World Health Organization. Many thanks.